Good morning and welcome to the Baltimore area chapters of the Links Incorporated webinar on COVID-19 and the state of Black health. I am Tawana Thomas Johnson, and I have the privilege of serving as the Health and Human Services Chair for the Patapsco River chapter of the Links Incorporated. In partnership with our sister chapters, Baltimore and Harbor City, we are thrilled that you are joining us for this important conversation. It goes without saying that most of us are all too aware of the devastating impact of COVID-19 on the Black community. This webinar was designed to provide insight and expertise by leaders of our community who not only understand the impact, but are actively fighting to mitigate the impact. With the rollout of the COVID-19 vaccine, our experts will also address the many questions and concerns our community has about its efficacy and safety. We are pleased to have with us today as our moderator, Dr. Nicholette Martin, who is the director of the National Health and Human Services Committee for the Links Incorporated. I have the pleasure of serving on Dr. Martin's committee and know firsthand the leadership she is providing to addressing the health concerns in our community. Dr. Martin is a board-certified physician in physical medicine and rehabilitation with a subspecialty in pain management. She has worked with patients suffering with chronic pain for over 25 years, focusing on multiple aspects of their health. Her practice focuses on weight loss, exercise, and changing behaviors around food in order to improve both physical and mental health. Dr. Martin is also an author and entrepreneur. After the release of her book, Love What You Eat, Choosing Foods That Will Change Your Life, she expanded her counseling practice to include individuals, groups, and public speaking. Please join me in welcoming our moderator, Dr. Nicholette Martin.
Good morning, everyone. And Tawana, thank you so much. It really is a pleasure working with you. Thank you so much for this invitation. Ladies and gentlemen, you have got the cream of the crop when it comes to experts. So you're going to get some amazing information. Please take notes because this is information that you can share with your family, your friends, and your coworkers. At this time, I request that you hold your virtual applause. In the interest of time, these amazing people have such wonderful bios, but I will definitely give you some highlights of all of their accomplishments. First, we have Shavon Bradley, who is the founding principal of REACH Beyond Solutions, LLC, a public health policy, advocacy, faith, and executive leadership firm. She is the co-founder of the Health Equity Cipher Group, which is a collaborative of nationally recognized health equity experts. She has over 19 years of experience in the areas of public health, health equity, policy, advocacy, external affairs, social justice, and organizational leadership. This New Jersey native earned her Bachelor of Science degree in exercise science and a Master's of Public Health degree from Tulane University in New Orleans, Louisiana, my alma mater. Ms. Bradley also graduated in 2016 from the Samuel DeWitt Proctor School of Theology at Virginia Union University with a master's degree in divinity. She is a member of the executive board of Delta Sigma Theta Sorority Incorporated as the co-chair of the National Social Action Commission. She is also a member of Jack and Jill and the Links Incorporated, the Columbia chapter, and she serves as the Eastern Area Chair of the Health and Human Services facet for the Links Incorporated. She is a co-author of The Queen's Legacy, a journey of trials and triumphs of phenomenal women. Ms. Bradley is also an ordained minister and serves as an associate pastor at Alfred Street Baptist Church in Alexandria, Virginia. She is married to Andrew Bradley and is the mother of a 6-year-old and a 20-year-old. Dr. Gregory William Branch. He's the health officer and director of the Baltimore County Department of Health. He's also a New York native who graduated magna cum laude from the State University of New York at Buffalo School of Medicine and Biosciences. He completed his training at Johns Hopkins University in internal medicine. Additionally, he received a master's degree from the University of Baltimore's Merrick School of Business. He's been practicing internal medicine for over 15 years. Currently, Dr. Branch is on the faculty of the Johns Hopkins Hospital of Medicine and the University of Maryland School of Nursing. He's a nationally recognized certified physician executive and the winner of the Daily Record's 2008 Healthcare Hero. Dr. Branch also participates in multiple community activities, including being the director and co-founder of Unified Voices of Johns Hopkins, which is a community gospel choir, and president and chair of the board of Project Plays, People Lacking Ample Shelter and Employment. Dr. Branch is a proud father of 2 sons. Dr. Stacy Garrett Ray is the Vice President and Medical Director of the University of Maryland System's Population Health Services Organization and President of the University of Maryland Quality Care Network and Transform Health Maryland. She received her bachelor's degree of science with a major in biology and a minor in women's studies from the University of Richmond, where she was a Cigna Scholar. She received her medical degree from the University of Maryland School of Medicine and did her residency in family medicine at the University of Maryland as well. She received her MPH and MBA from the Bloomberg School of Public Health in 2005. Previously, Dr. Garrett Ray also served as the medical director of the Baltimore City Cancer Program of the University of Maryland's Greenbaum Cancer Center, which provides cancer screening, treatment, and diagnostic services to low-income residents of Baltimore City. As a board-certified family physician, Dr. Garrett Ray continues to practice primary care in Maryland and currently serves as the University of Maryland Medical School's COVID-19 response community provider liaison. She resides in Reisterstown with her husband and her daughter. Dr. Crystal Watkins Johansson is a native of Baltimore who attended Baltimore City and public schools. She went on to become the first female Meyerhoff Scholar from the University of Maryland, Baltimore County, to earn a combined degree of doctorate and M.Div. She is one of only 3 African-American women to earn a doctorate in molecular and cellular neuroscience from Johns Hopkins University School of Medicine. Currently, she's the Assistant Director of Geriatric Outpatient Programs and the Director of the Memory Clinic in Neuropsychiatry at Shepherd Pratt Health Systems. She was recognized in 2019 as Physician of the Year and a Healthcare Hero and one of Maryland's top 100 women by the Daily Record. Dr. Watkins has positioned herself as an advocate for the city in which she was born. She believes that education is the link to bridging health disparities. She's a member of the Links Incorporated, Alpha Kappa Alpha sorority, and Jack and Jill. She is married to Nicholette and has 4 children, including 2-year-old twins. Welcome to all of our speakers. So let's get started. This first question is, I'd like everyone to weigh in, if you would please. Just in general, discuss 1 or 2 of the impacts of the COVID-19 virus on Black health and well-being. Shavon, if you'd like to start.
Well, thank you so much, Dr. Martin. Great to see you, my fellow Tulane alum and sister in Lincoln. I really want to highlight 2 things. One really has been the economic impact. For those of you that understand the work of public health, we survey disease and survey the impact of social experiences on disease. And so when you think about the Black community, there's been a massive economic impact, really because of loss of jobs, because of challenges with being a frontline worker. Many of our frontline leaders are African Americans who do a number of jobs that make you interface with people. And so it puts you at high risk. So if you can't go to work, you can't get paid, there's been major issues there. I think the second thing really has been around access to care and quality health care over a period of time. And the African American community in general has really been carrying the burden of chronic diseases for centuries at this point. And as we think about the long-term effects of racism in health, we do see challenges with quality access to care in our communities. And so what has really been a long-term challenge has been exacerbated by this pandemic.
Dr. Branch?
Good morning and thank you. I thank the Links for inviting me, and I want to give a virtual fist bump to everybody out there. Hello, hello, hello. I can just say that our Black and brown brothers and sisters have been infected and affected by this pandemic. Infected in that in Baltimore County, African Americans make up 30% of the total population. However, they account for 60% of the total folks who are infected by COVID. They're affected in that they make up a large percentage of both the hospitalizations and the deaths in the county. At one particular time during this pandemic, African Americans in Baltimore County were approximately 50 to 60% of the deaths. Currently, which is a blessing, it's now down to approximately 33%. Thank you.
Dr. Watkins, Johansson?
Just wanted to say it's a pleasure to be here with so many familiar faces, and Dr. Branch is one of my mentors, and everything I learned about medicine in the community, I learned from him. So it's great to follow up from him. I think that we have worked so diligently to keep ourselves and each other physically safe and healthy during the pandemic. But I think that it's critical to think about our emotional health. And I think as African Americans, we're on the front lines. We are the people who are at the airports and in the service industry, and the mothers, working mothers, and caring for our parents. And so I've just noticed a sharp increase in anxiety and stress. And I always say the head is connected to the body. So whatever happens from our physical and emotional from our physical standpoint, it also affects us emotionally. And what we've seen is increased rates of depression. We've seen increased rates of actually even suicide in African Americans during the pandemic. So it's not only affecting us physically, meaning that we are affected, as Dr. Branch said, in a disproportionately higher rate by the COVID virus itself, meaning illness and death, but we're also mentally being affected disproportionately as well. So I think that it's wonderful to have this forum so we can all have as much information as we need to be able to help each other get through this pandemic.
And Dr. Garrett Ray?
Yes, I just want to say thank you again for everybody for actually having us on here today, because this is so important, especially highlighting a lot of the issues that have already been addressed. I think that what we are seeing with COVID is this is actually showing us more and more about the issues in health equity within our country, and also how we're being affected with our Black and brown community, as Dr. Branch stated. I think one of the other things, just like Dr. Watkins was saying, the head and the body are connected. And so at this time, we are faced with more in terms of chronic conditions. So diabetes, hypertension, obesity, lung disease, heart disease, which impact our communities at higher rates and also increase our risk of getting COVID and also the complications that are out there. So there are multiple factors that are impacting this in terms of not just those conditions physically, mentally, but also what we were seeing about what we call our social determinants of health and the access, as well as the economics, living conditions, not really having as many options in terms of how we can reduce our spread and social distancing. But there are a lot of other areas where I think this is why it's so important that we're discussing this and maintaining health mentally and physically during this time to prevent any of our risks.
Okay, thank you. Dr. Watkins Johansson, in your experience as a psychiatrist, have you seen patients who've been triggered by the COVID-19 solitude in terms of increasing, which I guess you really just mentioned, increasing depression, increasing other mental health issues that maybe weren't there before, but are sort of coming to the forefront now that they've kind of been, alone for almost a year?
All right. I think that's an excellent question, Dr. Martin. And I think that what we know is that, I'm a geriatric psychiatrist, and I actually study resilience in patients that have memory loss and with aging. And what I always say is people's resilience and our ability to keep up our spirits are really being put to the test during this pandemic. And whether it's isolation or health concerns, job concerns, or just disruption to our day-to-day routines, they've really combined to make a challenging situation for, just about everyone in every walk of life, and especially for Black and brown people in the community. What we've noticed, though, is that I would say there are two populations. We've all been affected, but I would say there are two populations that we see in mental health. And so first, those are my older patients, our seniors. And so really what has happened is they've been especially punished because they've been isolated in their homes, and as well as they're being dying at a disproportionate rate compared to a lot of younger people. And as we know, I think Dr. Garrett Ray talked about health equity. We know that a lot of times African Americans, we keep our seniors in our community. And so we often have neighbors or friends that will go and check on them. And so you can imagine whether it's my parents or my neighbors, not being able to see them, give them a hug, or even just be able to have a Sunday dinner with them has really been a major challenge for patients. And then we look at people who are in senior centers or nursing homes. We really realize that the family network and friends and family have really been the backbone for helping people, even in those senior and assisted living communities. And what we see is that there's not enough nursing staff or a general healthcare assistance in these facilities for patients to get the daily care that they have. So I have a lot of seniors that we're now doing phone calls with. Some of them are able to connect via Facebook or Zoom, but many of them have challenges. That's, technology is not their first language. So the other population really has been really students. So we think about, younger people and saying, okay, they're very less likely to be impacted by the COVID virus from a physical standpoint. However, many students across the nation, and I know there are a lot of moms out there and dads, are dealing with challenges to their social lives, their daily routine, and then really the inability to even access education. So not being able to go to class and see their friends. And then we talk about, especially in the Baltimore community, food insecurity, and some even have unsafe unsafe home environments. School is a safety zone. So so both ends of the spectrum, the geriatric population between isolation, and then there are also their comorbid health conditions, and then our young people, our students, not being able to have that network. And then the other thing too is we think about our population and when we look at drug addiction. And so what we've noticed is that in Maryland, there's drug and alcohol related deaths has jumped up more than 9% due to the coronavirus. And this is, there's actually a noted increase in alcohol and cocaine related deaths. People, because of the isolation, because of the change, and because of the lack of being able to be connected to their social support systems, a lot of people are relapsing. And it's interesting, we think about African Americans, and we are resilient people, and we used to have African American women, one of the lowest rates of suicide in the country and out of any demographic group. But it's a really startling statistic. I just read an article in JAMA Psychiatry that was just published in December, and it shows here in Baltimore, Black suicide deaths have actually doubled, like historically doubled, from March the 5th. From the date that the Maryland declared the state of emergency to May the 7th of 2020, when the first public spaces were reopened. And scientists at Johns Hopkins found that these suicides among white appeared to drop by half, but actually upon African Americans, they've increased. So there's something about being connected with each other that it's affecting us mentally as well as physically.
Okay, wow, that's pretty startling. That is really pretty startling. Ms. Bradley, we know that the Black and brown communities often experience barriers to care, which you mentioned in your opening answer. Can you talk a little bit about the impact of our community sort of in general during the COVID-19 and some of the specific barriers?
Yeah, absolutely. We talked a little bit about access to care, but I will say additional barriers are access to vaccines, which we're talking about pretty soon. There has been conversations really happening with our most vulnerable population, our seniors. Right, access to transportation. This is why social determinants and now political determinants of health are a major discussion in Black and brown communities. So when there's lack of access to transportation to get to the appropriate pharmacies or appropriate sites, we won't even talk about access to the vaccine just in general, right? Having enough to meet the demand of our patients. Another interesting space as we think about Black communities, though, has been the conversation around mistrust. Now, this has come up a lot around our historical connection to issues like Tuskegee, and those issues do make a difference. But I will argue and say that in addition to the Tuskegee experiences, the Henrietta Lacks experiences, right, we're in this area of Baltimore, we understand history. This is also around current experiences of Black Americans in this country. We have seen politically some of the most devastating pictures on video of death of African Americans. We've seen insurrections, et cetera. And that is all connected to our ability to trust a government or a system that has historically marginalized Black Americans. And this plays out very heavily, particularly in health access and health outcomes. Stressors of being African American in this country have been exacerbated by this pandemic. Looking at, of course, we talked about education, which is a specific gap we're seeing where Black students may or may not have the same access to broadband as their white counterparts or other counterparts. So in essence, we're seeing that the pandemic has done more than just affect your personal health by being infected. The affected side, which is what the doctor talked about earlier, has even grown. I think also about nutrition. If you recall, when the pandemic first started, this idea of getting access to healthy foods has been a challenge. And when we take children out of schools, this is why feeding programs and meals have been so crucial. Many of our children have relied on schools for daily intake. And so when you go through a pandemic, schools are now in many places providing meals. And this is where our children are able to get some kind of nutritional value. So if we don't have the products that we need in order to make fresh fruits and vegetables and the lean cut meats that we need in order to sustain our health, that has been a major factor for the Black community. I think the last thing is, quite frankly, looking at the long-term effects, right? So we're talking about lives being lost. We're talking about households being turned upside down, and that we're still dealing with the same underlying conditions. So beyond COVID-19, there are still challenges with the chronic diseases, the heart disease, the asthma. I'm an asthmatic, I understand, diabetes, challenges with some of those long-term chronic diseases like cancer. This is a tremendous impact on our community. And if we do not address those political and social determinants of health, voting, access to civic engagement, but also thinking about systems where we have access to jobs that are equal paying, that are not discriminatory of our communities, we will not see an end in sight. And so this is why organizations like ours, like the Links, and those of us that do this work in service must continue to sound the alarm on these issues.
Okay, thank you. Dr. Branch, so now we have come to the piece de resistance, the vaccine, okay? Can you break it down for us in terms of what is it? What's in it? What are some of the side effects? We've already talked about, the African-American community hesitation to take it. So how can we reassure people that we understand it's been rushed through the process and, these are unprecedented times. None of us have ever seen this in our lifetime. Hopefully we'll never see it again. But be that as it may, there's something here that potentially can help you. But how do we get people to that point?
Wow, that's a whole lot. Okay, but I'm gonna try to break this down as best as I can. So let's talk specifically about the vaccine and what's in it. I'm gonna try to make this as simple as I possibly can, so follow me. In the vaccine, there is something that we call, it's a messenger RNA vaccine. And what does that actually mean? That means that is some genetic material that was made in the lab. And then basically when we inject that into your body, your cells can then make a protein that looks like the outer surface of the actual virus. So let's just say it's making a protein, gets a portion, and we're going to say it's making the face of the virus, okay? And so that's what it does. It does not affect your DNA. It does not affect your cells in any way, shape, or form. It just lets your cells know that this is the face of the virus, and it is an invader. And your body then looks at that protein and says, we're going to destroy it. And that's a very, very good thing. So it does not affect your DNA. It does not affect your body in any way, shape, or form. What else is in the vaccine? Other than the messenger RNA, there's some salts and there's a little sugar, and that's basically it. So overall, I understand that we have gone through a lot as it relates to um, not trusting the medical community and the government on a lot of different things in the past. And that is true. I understand that. We're in 2021 at this point now, and we're in the midst of a pandemic, which is affecting and infecting Black and brown people at a greater proportion. So I have to say at this point now that overall, it is a safe vaccine, and the side effects of those is going to be some local side effects. You may have some pain or redness at the site. And there's some general stuff that you may have. You may have some fever. You may have fatigue or a little what we call GI effects, stomach effects, a little nausea, some diarrhea. And overall, it's usually very minor effects. There are some people who might have an allergic reaction to the vaccine, and we're able to take care of those people also. So generally and overall, it is a vaccine. It is very effective. There's minor effects to it, side effects to it. And I say at this particular time, it's important for everyone to take it. It's very, very important. And I recognize the apprehension people may have about it. But think of it this way. I'm saying to you that I can potentially give you a vaccine that is life-saving. And you say, well, I don't want to take it because I don't trust the medical community. However, if you then get the virus and you become infected, the first place you're going to come is back to the medical community for us to take care of you. And so at this particular time, I say definitely take the vaccine. And if you have any other questions about that, please talk with your doctors in regard to that. So I hope I was able to answer all of those questions.
Yes, that was perfect. Thank you so much. Dr. Garrett Ray, how effective is the vaccine? And in terms of behavior, because that is still a big issue, can you talk a little bit about what happens? So I've had my 2 vaccines and I'm 2 weeks past the second vaccine. I'm supposed to be whatever, 80 to 90% protected. But is that really true? And then how do I act or how do I behave going forward?
Excellent question. So the 2 vaccinations that are out there, and Dr. Branch described those beautifully. We have 2 mRNA vaccinations that people are hearing about. Those are Pfizer as well as Moderna. And so both of those have been studied. And I have to say, mRNA, some people say it's this whole thing with vaccinations has been happening so fast. Well, actually, we've been studying this for a long period of time. There have been researchers doing this for several years. And the studies that were done specifically looking at COVID and how effective was the vaccination against protecting us, 95%. That is amazing. That is wonderful for us for those 2 vaccinations for Pfizer as well as Moderna. Now, there is another one that I know everyone is hearing about as well. That is the Johnson & Johnson vaccine. Works a little bit differently from the mRNA one, but it's still very effective, a little bit less. This one requires that you take 1 dose versus the other Pfizer, which requires 2 doses with 3 weeks in between, and Moderna, which requires that we have 4 weeks in between. The Johnson & Johnson one dose, but 66% efficacy, so it's a little bit less. Right now, I think one of the other questions that people are having is whether or not, if I get this vaccine and I'm done, am I able to just go out without my mask? And the answer right now is no. We all love the fact that we're getting more and more people engaged and involved and trying to make the right decisions for themselves. But until we get to the point, and I know we'll talk about it a little bit later, where we have a significant number of people that have actually been vaccinated, then we still have to make sure that we're reducing risk. So even though for me, I've been vaccinated, I received both of my doses, it's been over a few weeks, I still wear my mask. So this is not the mask I wear out, this is where I wear out, and we have other ones that are out there. But people are also asking the question, is one mask enough, or do I need to wear two masks? The thing is, you need to wear a mask that actually fits properly. That is one of the most important things. If you have to make a decision, wear a mask that is covering your nose as well as your mouth, because COVID actually lies within our nasal passages. So even though I'm vaccinated, I still potentially could spread to others that are not immune at this time. So we're doing this to protect not only we do this to protect our families, we protect those that are within the community. That's why we're doing this, and we continue. So you still need to do the 3 W's. I say wear the mask, wash your hands, and watch your distance.
Okay, that's perfect. So if not, everyone remember the 3 W's: wash your hands, wear your mask, and continue to distance. Watch your distance. Ms. Bradley, how can we help mitigate some of the fears in the Black community around the vaccine? So Dr. Branch talked about the fact that, this could save your life. For some people, that's not enough. So what else can we tell people? How else can we get the message across how important this really is?
Well, what's interesting is that our community historically has been connected to our families. And so the Black community is a community of fellowship. We connect together. And so in this COVID timeframe, for us to get back to the times of fellowship, I think about the family reunions that we missed, the weddings that we missed, and even time for those that have gone on to heaven, right? Those that have not been able to be celebrated in person together for their lives. This is the time where the vaccine has actually given us an opportunity to begin to recount and recalibrate our lives the way that we almost knew them before. Now, I don't know if we'll ever go back to being completely normal, right? I think there's some things that are going to now be socialized. Mask wearing is a thing now. So that's why we've got masks that are jewels. And, Black people, we are so innovative. We got good looking masks and hats to match them for church too, right? This is what we do. But in order for us to get that back, to alleviate some fears, I think Dr. Branch brought up something really important. That this vaccine is not out to make you sick. Right? That there are rules and mandates now that have been guided by the federal government, whether you agree with that or not, or even understand the history of that, there are rules and regulations. The FDA has certified these vaccines, which means that they are now ethically bound to ensure the safety of our patients. So it's about fellowship, yes, but it's also about ensuring you're protecting your family. And I want to say it this way, as a mother of a first grader, who is about to prepare for hybrid learning in the state of Maryland. Many school districts are now going back. I think about our children. Think about the most vulnerable, the sandwich generation, those of us that have parents that are still living and have little people. We are protecting those that we love the most. The last thing is also having faith. I am a preacher, and so I always think about the faith that we have as a community, how we've kept ourselves over historical experiences. African-American communities have been the most innovative communities there are. And what we have done is survived in this time. So for us to sustain our legacy as a people, we must do the right things and be the examples to those that need it the most. Our seniors, those that have underlying conditions, and then those that are frontline workers. The fear is not a false thing. We understand fear, but we cannot let fear get in the way of us changing our trajectory in life. And this is about the future.
Okay. Dr. Watkins, so there have been a number of different reports out there. Some people saying once you've had COVID, you have 3 to 6 months immunity. Then the numbers went up from 6 months to a year. So can you talk a little bit about what it means to have antibodies once you've actually had the COVID virus? Okay. And are you protected? And if so, for how long? And what does that mean in terms of people who, do I get the vaccine if I've already had it? Do I not need the vaccine since I'm covered? That type of thing.
Yeah, you asked the hard questions, but the informative ones. So I think that this is something that a lot of people have been asking about. So what the CDC, so Dr. Branch eloquently explained what the virus is and what the vaccine does. So you have this circular coated protein that's around the vaccine. And when you naturally, around the virus, when you get an infection, then when you're infected with the COVID virus, what happens is your immune system is exposed to it and your body mounts a response. And that's what antibodies are. And so what happens is the difference between having what we call the natural protection or immunity from reinfection, like we think about the chicken pox, when you get it once and you have it for the rest of your life, versus the vaccine, is that sometimes you don't mount a full enough response against the virus itself to protect yourself. So even though getting the actual COVID-19 may offer some natural protection or immunity from reinfection, it's not clear how long this protection lasts. So we have experiences, like I said, with chickenpox, you get it once and it lasts for the rest of your life in general. Or is it like the flu, where every year you're going to need to have some other exposure? So because reinfection is possible, and it can cause severe medical complications, it's recommended that people who have already had the COVID-19 virus itself get a COVID-19 vaccine. And if you have COVID-19, what they're saying is to wait until 90 days, which is about 3 months after your diagnosis, to get that COVID-19 vaccine.
Okay. Dr. Garrett Ray, previously we mentioned that you worked with cancer patients. So if you have cancer or other diagnoses that will suppress your immune system, should you still get the vaccine?
Yes, you definitely should. And also talk to your primary care provider, as well as if you do have cancer or you're immunocompromised in any way, speak to your medical specialist on this. The studies were actually done and included those that are immunocompromised, so cancer, HIV patients, etc., and showed that it was highly effective. Now, the reason why we also say it's so important to make sure that you are getting the vaccination is because of the fact that our immunocompromised, our patients that have cancer, and others with other conditions actually have a higher risk of actually hospitalization and death. So we want to make sure that you do get the vaccine so that we can build the immunity that Dr. Watkins, Johansson was speaking of, so that we can build those antibodies and help to protect you so that you won't be hospitalized, so that you won't have side effects or really deal with a lot of the things that we know can occur with COVID. So again, it is very important that you do speak to your provider, ensure that you don't have any allergies or any contraindications to get it. But at this time, we are recommending that patients that have cancer or immunocompromised or immunosuppressed in any way do get the vaccine.
Okay, and you mentioned immunity a number of times. Of course, there's I don't want to say a catchphrase out there, but the phrase that Dr. Fauci has always been telling us about, herd immunity. So can you talk a little bit about what that is and how many people need to get vaccinated before we as a society are covered by the herd immunity concept?
Excellent question. So herd immunity, you are hearing that everywhere. I mean, I think I've heard it in the grocery store and never expected to hear anyone say herd immunity in a Wegmans, but we're hearing it and it's excellent. So what herd immunity really is the term that we use to describe how can we slow the spread and infection of a disease within our population. Okay, so the way that this works is how many people can we actually build that protection with. So Dr. Watkins, Johansson, Dr. Branch were speaking about how we have antibodies, we build them naturally, but we also get them through the vaccination. So that's why it takes two things in there that we take a look at for herd immunity. Increasing vaccination, recovering from COVID, help to build that. But at the same time, right now, the key thing is that also helps us to reduce the spread of the virus. So the more of us, say that we've got 10 people who actually have either they're in this population, and then you have those individuals, some of them have been vaccinated, and some of them currently actually have natural immunity. It's very hard for them to then be able to spread the virus. The thing about COVID, as well as other viruses, is that they need to be able to live by getting other people infected and then spreading it. So if you stop that pattern for the virus, the tricky virus that it is, then that helps us to then make sure that it cannot continue within our community. And it gets us closer to our sense of normalcy that we hope we can get to at some point. In terms of the numbers, there has been back and forth, but we're still taking a look at that. But it's got to be a large percentage or majority that we try to get to in terms of the population. So that's really pretty much how herd immunity works. So that's why it's so important. And we're trying to make sure that people are going out there and getting vaccinated, because if not, then we start to get into another discussion. COVID, again, spreading and then increasing our risk of it becoming or changing. And that's where we start talking about variants. So we're talking about, and we are already seeing South African variant. We're also seeing the ones from UK as well as from South America. So again, we have to do our part. Each of us has to do our part. Make sure we're getting vaccinated. Make sure that we're wearing our masks to reduce any type of spread, washing our hands and watching our distance to help us to get to herd immunity.
Okay, and thank you so much for that lead-in. Dr. Branch, can you talk to us about these variants? We're telling people, wear your mask, wash your hands. I'm doing everything right. I'm staying home. I'm washing off all my plastic. I'm getting my vaccine. And now you're telling me that there's a new virus out there, and is it more severe? Is my vaccine going to cover it, or am I back to square one?
Okay, so let me explain it this way. It is not new that viruses mutate. That is old, and we know that they mutate. So I'm going to go back and try to explain it from a perspective of when I said that the messenger RNA we injected in your body now makes the protein, and that protein has the face of the virus on it, right? And that's how your body can recognize that virus. So when a virus then mutates, what the virus does is it says, oh, I'm going to put on a hat. And then when that virus is exposed and your body looks at it, your body says, I know you. I know exactly who you are. You can't fool me, so it attacks it. It's fine. And then a variant says, I'm going to put on a mustache. And your body says, I can still tell that. I can still tell that's you. And then the variant says, I'm going to put on some glasses. I can still tell it's you. So these vaccines that we have can still tell the variants, even though they have a slight change. And then the variant says, I'm going to put on a mask. And everybody says, oh, you got a little mask on. But I can still tell it's you. I'm going to kill you. After a while, a variant can then come up with a hat, glasses, mask, and mustache. And then your body says, I don't recognize that. And that's when it becomes a problem. So at this particular time, some of the variants may be wearing a mask, it may be wearing a hat. The vaccine can still recognize it. Your body still recognizes it. That's why it's so important that we vaccinate everyone as soon as possible so that we don't give the virus a chance to have so many variants that the vaccine doesn't recognize that. I hope that actually made sense. Trying to break it down as basic as I possibly can. So overall, the vaccines that we have now are able to protect us against severe disease of all the variants that we have identified thus far.
Okay, thank you. That was absolutely perfect. I think that's a really easy way for people to remember what's going on. And I like the hat mustache. That's a great analogy. So thank you so much to all our panelists. Before we open it up to questions, I'd just like to mention that on the Facebook page of the Patapsco River Links Incorporated, they have a resource guide. And this resource guide can answer a lot of your questions that our experts have talked about today. They can possibly give you, they can give you phone numbers and contact information. So you're going to have more questions because things keep changing every day. So please take a look at the resource guide. Talk to your providers, look up or call the CDC. Everyone's out there has information for you. So if you have a question, please try to get it answered. At this time, we're going to looks like we have a lot of questions, I think. A lot of congratulatory remarks and thanks to our speakers. One of the questions I saw here was, everyone talked a little bit about our immune system and how you have to have a healthy immune system to fight off the virus. So how can we increase the health of our individual immune systems? Anyone?
Sure, I'll start off. So a few things I would say. One, food, nutrition are so important to make sure that we remain healthy. Making sure we're well hydrated is critical. So drinking plenty of water. I keep my water with me. So making sure that we're doing that. Also, we're finding that low levels of vitamin D also are impacting our immune system for COVID-19. So that's one thing that I am recommending for people to, especially if we're not taking in enough in our diet. So within our community, a lot of times we're not taking in some of the products that you normally have vitamin D. So, reducing our dairy that we may have, well, guess what? There's some other, that could impact us. So please make sure that you're getting your vitamin D in your diet. They come in great gummies now, so you don't even need to worry about anything else. So my whole family, every morning, we're getting our gummies of vitamin D, and we're getting our vitamins, because we don't always get what we need within our diet, but those things are critical to make sure that we have a healthy immune system and getting enough rest. So I know, the mental health, and I will defer to Dr. Watkins Johansson on this discussion on there, but it is so critical that we reduce our stress as well as making sure that we're getting enough rest. So food, water, and also the nutrients and the rest, and exercise.
Exercise, absolutely.
Yeah, I was waiting on the exercise. That's great that you said that. I am a background in exercise science, and that's really been one of the best kept secrets of wellness is exercise. And let me just say this: in the midst of COVID, because for those that have gone to gyms, many don't go back to gyms anymore, or some of us didn't even have access to gyms. Well, this is when your home becomes your actual home gym. And I don't mean having a massive amount of equipment. I mean being physically active. What does that mean? Putting on the radio, putting on the TV, stream that video, stream that YouTube, and start dancing. I'm talking about old school, getting down and starting to sweat it out, because part of this is really around increasing your heart rate. The more you use your heart muscle, the stronger it is. And that comes from being physically active. If you have little ones, actually go outside with them, throw snowballs in the snow. When it's warm, take a walk with their families. This is what we realize, is that folks were saying, well, I can't even go outside and walk. Actually, fresh air is a part of that process. And so increasing physical activity does not have to be an expensive experience for you. It can be that you're on the sidewalk right by your house and walking up and down that sidewalk, a little bit of step movement, because that increases your heart rate. And then stretching and using your body for quiet meditation time to reduce stress. Prayer time, quiet time, those moments to yourself actually help you. And as far as rest, one of my best pearls of advice that I got from one of the senior sisters was go to bed the same day you woke up. And that has helped me tremendously in this time. So when I start getting close to midnight, I'm like, well, it's already tomorrow. I got to go to bed. So that's a great tip for everyone.
That's excellent. Okay. Please speak on the mental health resources available for parents who have teenagers. Dr. Watkins Johansson?
I think that's an excellent question and kind of a good segue from what we were just talking about, the immune system. So first off, I'm at Sheppard Pratt and also at Johns Hopkins. Sheppard Pratt now actually has a virtual walk-in clinic. So for anyone, whether you are, whether you have young children or older adults, you don't actually, they actually have the actual clinic where you can come in and get resources, or you can do the virtual walk-in clinic, and it's right there at the Shepherd Pratt website, and you just type in COVID resources when you get to the Shepherd Pratt website. So there, in addition to having some places where there's a 24-hour hotline if you need to connect with someone for your children. But I think also one of the things is, we know that stress can kill you. And when we're thinking about taking care of our children, I think of, the analogy I say, when you're on the airplane, they say what, put your mask on first. If we lose oxygen, put your mask on first before you're helping your children. So making sure that you are doing what you need to as well to help to relax. And when I say relax, I have an acronym, and that's really one way to deal with stress. And so I think the other speakers have talked about that. So R really is reaching out and staying connected to others. So if you feel like you need help or in distress, or if you have a child, making sure that you do reach out and use those resources. And also, one of the strongest and most robust predictors of resilience or getting through difficult times is really the association between social support and health. And then the E for the relax is exercise. And so we've talked about that. And exercise can just be going out and getting, a walk. The L is really limiting negativity, whether that's negativity that you get from the news or negativity you get, feeling stress from work, or from having to do your Zoom call while your kids next door, having virtual school, but really limiting any kind of negative thoughts and taking time for yourself. And then I think affirmations, affirming yourself spiritually, nourishing your spirit. You may not identify as a religious person, but you can really benefit from nourishing your spirit, which means just turning off the phone, turning off the computer, turning off the lights, just sitting, meditating. And then the X is actually lowering your expectations. So some people, we think that when we have these periods of quarantine, we're going to bring unprecedented productivity. I'm going to write that novel. I'm going to organize my closet like Marie Kondo. But really and seriously, don't underestimate the cognitive and emotional load that the pandemic brings. And so sometimes it's good. I was just at a Jack and Jill event, and they talked about being just a good enough parent. So when you're juggling all those balls and trying to be, the good wife, the good mother, and the good person at work, sometimes it's good to just be good enough. So again, just relaxing, that's going to help your immune system. And the first R is reaching out, as the person talked about that comment about getting help for yourself as well as for your children.
Okay. Dr. Branch, you want to answer this one? Talk about after I get my vaccine, can I get on a plane and go to Mexico? Can I travel?
So at this
I need a break. I need some sunshine.
So I need that too. The fact of the matter is that when we get the vaccine, we still have to continue our 3 W's. We've got to continue to wash our hands, wear the mask, and watch our distance. We got to remember that we are trying to help protect others. So even though I may have a vaccine and I may not get severely ill because of that, if I'm carrying the vaccine in my nose, I can potentially give it to a loved one. So I would say at this particular time, until we are able to get into that herd immunity where a lot of people are vaccinated, I would try to take the precaution of not doing as much traveling, especially given the fact that we know that the virus continues to want to mutate and become a different variant. And you don't want to be vaccinated and then exposed to that variant that then had on all of the hat, the glasses, the mask, and the mustache. You don't want to do that. So at this point now, I would still say it's very important that we do not continue to do a lot of that traveling, because you may not be ill, but you may bring that variant back to someone else.
So now I'm thinking about getting my vaccine, and I'm going to an outpatient facility versus a hospital. You spoke about, there are some side effects. There are some people that have reactions. So if I go to the PG Sports and Learning Center, where I know they're giving out vaccines, should I take an EpiPen with me?
So anywhere, and I'm going to talk specifically about Baltimore County, and I'm pretty sure this is for anywhere else. Any place that's giving the vaccine, we have the medications and the personnel there to treat you if you have an allergic reaction. You need not have to bring anything with you. If it makes you feel good that you got an EpiPen in your bag, that's probably because you always carry an EpiPen. So I'm not going to say that you leave the EpiPen home because you don't know what exposures you're going to have before or after. But at any of the sites where we're giving the vaccine, we have all the drugs and all the medical personnel to be able to treat you and to transport you to the hospital if necessary.
Dr. Garrett Ray, can you talk a little bit about people going out? And I know I've seen this as well. Like don't have my vaccine yet, and I'm trying to do everything right. So I'm not going to see my GYN, and I'm not having a physical, and I'm not getting my mammograms because I don't want to go to the hospital because everybody at the hospital has COVID. Okay. How should we handle that?
So great question. So I'm a family doc by trade too. I still see patients, and we have figured out ways to make sure that we can still bring care to you. Okay. So I just want to make sure people understand access to care is critical. And that's one of the things that we always are saying, okay, well, why are we seeing different numbers? We have opportunity. A lot of us have opportunity and take advantage of the care that you are able to receive. We still have to take care of our diabetes, high blood pressure, heart disease. All of those things are so key and important. In the beginning of the pandemic and even now, I mean, we're seeing that the numbers drop significantly for people coming in for heart attacks and strokes. Heart attacks and strokes didn't go away. It didn't stop because we went into pandemic. People were dying at home. And so we need to make sure that we are getting people into your care. We do a lot of telemedicine. So almost everyone now is using either Zoom or some type of capability that you can actually connect with your provider. So please make sure that you maintain those. The other thing is the providers, outpatient as well as within the hospital, we have done things to try to reduce any type of spread. So either limiting the amount of people that are coming in. We have cleaning precautions that have taken place. So if it is something that requires that you do come in, we want to make sure that you are safe at that time. But you do need to come in, need to continue with health maintenance. And also, if you're on any medications, I strongly recommend ask for a 3-month supply if it's a maintenance medication with some refills on there too, if that is appropriate in terms of your health care, because you need to make sure you have what you need in order to stay healthy. That is something that is so critical and for all of us, because at the end of this pandemic, you want to know that your diabetes is under control or your blood pressure is under control and that you don't have heart disease because we weren't getting up and moving like we needed to or controlling those. So our personal health, critical, helps us to remain safe. So get on in.
Okay. Miss Bradley, can you talk a little bit about, or can you give me some tips? So I'm between 65 and 74. I'm not tech savvy, so making an appointment on my computer to get my vaccine is not working. My grandchildren can't come over to do it for me. How do I get an appointment to get a vaccine? Are there any other suggestions, any way you can help me with that?
Absolutely. Well, there's actually great organizations that are hosting this panel today. Organizations like the Links Incorporated are sorority organizations. I know there's members of Alpha Kappa Alpha and I'm a Delta. We actually are being a big part of the solution. If there are seniors, we call them seasoned saints, right? If there are seniors that you know that cannot engage, it's really important to reach out to family members to help you do this virtually. There's ways that we could do Zoom calls together. There are opportunities also for you to contact your local health departments. Each county has done very, very varying things for each of their residents, but there's also been some mass sites. So I know a lot of times the appointments are online. That has been a technology barrier. This is why we always want to phone a family member, phone a friend, find out who needs an appointment and get their information online. I think another thing that's really important, is if someone is in your circle, in your COVID circle, if you have someone that you know that has been around you close enough that has not been infected, it is okay to interface with them and be able to do that for them in person, but not if they're not in your COVID circle. We want to be very, very clear on that. So contact your health departments. There's also text messages that are coming through. Many of our seniors may or may not be tech savvy, but they do know how to respond to a text. And so make sure that you're getting on the M.Div ready text messaging services as well. M.Div READY, M.Div ready.
Okay. And again, just a reminder, the resource guide that we mentioned initially, it's you can find that at Patapsco River Links.Inc.org. Okay. Patapsco River Links.Inc.org. And at this time, I would like our presenters to, again, thank you so much for this information. It has been absolutely amazing. If anyone has any final closing thoughts, any other information that we could use, I'd appreciate if you'd share with us. Everybody's tired.
I'd like to say that we're all leaders within our families and our communities and at work. And so at this time, we need to actually lead by example. So I think it's critical that take the information that we have, let the science lead us to making the right decisions in order to protect us, get through this, make the decision that's right for you and your family for vaccination, because we all want to get out of this. We're losing generations of people. I think all of us have been impacted in some form or fashion, that either we have seen family members hospitalized or unfortunately we've seen people die, and we don't want that to continue. So everyone on this call is a leader. Everyone listening to this is a leader. So lead by example, follow the science, make a difference.
And I think that's a good point that Dr. Garrett Ray said, is that I often get the question from people in community, why do I need to get the vaccine? I'm young, I'm healthy, I don't have any other conditions, and it's really not for you. It's for your neighbor, it's for your church members, it's for your parents, your grandparents. That's really why we all should get vaccinated. It's safe and effective, but that's really what we're doing, is for our community. We're only stronger when we're together, and we have to be able to all work together and also get vaccinated together in order to be able to fight this pandemic.
I do see one more question here. If you could talk about vaccines for children, where are we with that? Dr. Branch, if you'd like to take that question.
So at this particular time, we have to remember that the studies have got to go first. We can determine the safety and efficacy in a particular group of people. And at this particular time, they are working on studies for children less than 16 years old. But those studies are not out at this particular time. So right now, Pfizer, which has been approved, is 16 and over, and Moderna, which has been approved, is for 18 and over. And we're going to have to wait to see what the studies show for the vaccines in the future for the children. So right now, these vaccines are not for children under the age of 16.
Do we know if the new vaccines from Johnson & Johnson or AstraZeneca are being tested on children, or they're also studies only on adults?
I'm not familiar with specifically what they're doing, but I can tell you that all the vaccines will be going in for testing for children. What we have to remember is we knew the population that was being severely affected by it, and that was the older people. So one of the reasons why this got through so quickly was because they didn't do the children, but they purposefully did not do the children. And so all the vaccines will be studied on the children as time goes on. But for right now, they're working on the population that's been most affected by it, and that's the older population.
Okay. As soon as I said there were no more questions, we got more questions. Dr. Garrett Ray, can you talk about how long, or do we know how long the vaccine will last? and potentially with the variant, the guy that's got on the mask and the hat and the mustache, will we have to get a booster?
So great question. Our research team is actually working on that to evaluate whether or not we need to have a booster. So we're not sure exactly yet whether or not this is something that's going to be an annual thing that we have to do, or is this something we need to do maybe every 2 to 3 years or need a booster. So more information is coming. The individuals who are in some of the first trials that were done, and I can speak to what was being done at University of Maryland downtown with our Center for Vaccine Development. Now we are looking at the antibodies that they make, or that immunity, and then also the impact of getting a booster. So stay tuned. We'll get more information on that. More to come.
Okay. And we know right now, we've talked about the Pfizer and the Moderna. Those are the two that are on the market. I know people have read different stories about, well, President Trump only purchased so much Pfizer, and now we can't get any more of that, and so we're going to use Moderna. President Biden has 200 million doses of Moderna. Do we have an option on which one we take, or at this point, is it what's available?
I'm going to talk about this from a practical perspective. One, I think that patients always have an option. They are in the driver's seat. And so therefore, if you choose to have one vaccine over another, then you can choose that. Now, from a practical perspective, we have a shortage of vaccine. And I'm going to tell you, as the health officer, if you get the opportunity to get one of those vaccines, take it. Take the vaccine, irrespective of which one it is. They all have an excellent efficacy, and they all have, at this particular time, very low side effects. So don't sit there and say, well, I want Moderna because I like the way Moderna sounds. It's a better sounding word than Pfizer. No, if someone calls you and says, I have an appointment for you, and it's for this vaccine, take it.
Very well put. Very well put. Okay, now I think we really are out of questions. So I'd like to thank everyone again. This has been a marvelous panel. This information, it never gets old. It's always changing and updating. So that's why it's important for people to stay in touch. That's why it's so important for us to have webinars like this. Again, the resource guide is www.pataxcoriverlinksinc.org/COVID-19. And at this time, I'd like to bring in the presidents of the chapters who have sponsored our wonderful event. Stephanie Rollins-Blake from the Baltimore chapter, Shavon Ferguson from Harbor City, and Kimberly Robinson from Patapsco River. Thank you again.
Hi, thank you so much for hosting us or being the moderator. And I want to thank every single one of the panelists. In my message in social media, I asked people to join us for them or join us for you. And I hope that you means that you're going to share the information that we learned this morning with your entire social network. So thank you again for sharing. And I'm very proud that my Links chapter member, Dr. Crystal Watkins Johansson, was a part of this informative conversation.
Good morning. My name is Shavon Ferguson. I'm Vice President of Programs for the Harbor City Links chapter. And on behalf of our chapter and our president, Link Elizabeth Williams, I just again want to echo what Link Stephanie said, and we want to thank all so much for participating in the webinar. We hope it was informative, that it provided you with the information that you need to really navigate through this pandemic. We know that there is light at the end of this tunnel, and we want to thank our panelists as well as all our members of the respective chapters for providing this webinar that consisted of such a wealth of information for our communities. We hope that you have learned valuable information and that you are encouraged to move forward through this pandemic and continue to be safe in the pandemic. Thank you.
Good morning. I'm Kimberly Robinson. I'm the president of the Patapsco River, Maryland chapter of the Links Incorporated, and echoing the sentiments of Link Stephanie and Link Shavon, I just want to again thank all of those who have joined us on this Facebook Live this morning. A special thanks to the chairs of the Health and Human Services facets of the 3 chapters and their committee members who have done an incredible job building out this webinar and providing such important information to our community. Just want to reiterate some of the really important takeaways that I got this morning. I will continue to promote the 3 W's: wear your mask, wash your hands, and watch your distance. I will take away the message that Shavon Arline-Bradley shared with us, to do your best to go to sleep the same day you woke up. That one really spoke to my spirit. That's not a habit that I have, but one I clearly need to develop. And I want to particularly thank Dr. Branch, I think, for his very skillful breakdown of the vaccine. I've seen wonderful responses and comments as you all have appreciated getting a better understanding of how the vaccine works in our bodies, why it was developed as quickly as Dr. Garrett Ray shared, and certainly understanding how to manage our mental health in the middle of the pandemic, as Dr. Watkins Johansson shared. So thank you again to our panelists. A special thank you to our moderator. Dr. Nicolette was fantastic, keeping our conversation going. And I'd like to thank all of you for being with us this morning. This was an important conversation. We're happy that you joined it. Know that this will continue to be posted on our Facebook page going forward. So if you've got friends or family who were not able to join us, you can share this with them later so they can still get this information. And please take a look at the resource guide. It's pinned in the chat, and it's available on the website of the Patapsco River, Maryland chapter. And I know it will also be posted by the Baltimore chapter and the Harbor City chapter. Thank you so much for being with us today, and we're glad that you appreciated and got to enjoy the webinar.